We are back with our friends from Surepoint ER to talk about RSV. It happens to be kind of RSV season. We're seeing a lot of it in our community, and I have Dr. Kim Onufrak here to give us some insight on what it is, how to prevent it, and how to keep ourselves and our children safe. Great to see you again.
Thank you for having us back.
First of all, I've heard RSV. I honestly have no idea what it stands for. What is it?
RSV stands for respiratory syncytial virus.
Okay, and what does that mean?
So it is a virus that causes usually lower tract infections in younger kids, usually between the ages of 2 months to 8 months old, but we're seeing it now in older children and even some adults.
Okay, can RSV be fatal?
It can be if it gets to the point where they're not able to get great oxygenation, and then if you're under respiratory distress, then it can go into cardiac arrest. But
okay, so it's pretty prevalent right now. Let's talk about prevention. How do we prevent ourselves or our children from getting RSV?
So unfortunately, it's all symptomatic treatment. There's not a vaccine right now to help prevent it.
Okay.
So, and it's usually spread by respiratory droplets, touching an area that is infected with the virus. So really, it's prevention. So if you're sick, then definitely wash your hands, cover your mouth when you cough, and stay home. You know, if you try not to bring anybody that's sick around your children or around your babies especially.
Absolutely. I think if there's one thing we learned from the pandemic, it's addressing whether or not you're not feeling well and having enough respect to either cover your face or just stay home in those circumstances. So for anyone who may be suffering from some of these symptoms, what are we looking out for, and at what point do we take ourselves or our children to the hospital?
So usually it'll prevent with cough, sometimes harder work breathing. So when you see that in your child, if they're just coughing to the point where they're throwing up and they're not able to breathe, they become severely dehydrated, they need to be seen in the emergency room.
Okay, and what does treatment look like in that case?
So usually it's symptomatic. If they're dehydrated, we give IV fluids. If they're having hard time breathing, we do oxygen supplementation sometimes. If they have wheezing, then we'll do bronchodilators, inhalers or nebulizers, and then maybe a steroid treatment.
Okay. I mentioned earlier RSV season, kind of like flu season or any other one, right? Is it truly kind of a season that comes more around winter when people are more sickly?
Usually it is in the winter, and we are seeing a spike in cases, unfortunately. You know, and you can have RSV and flu at the same time, or RSV and other symptoms, and that's the concern. And when you have a child that is so young, you know, you really want to watch out.
Absolutely. And you did mention that this is possible for adults to get it as well, right?
Yes, adults can get it, especially if they work in a daycare center, if they are a healthcare worker in the hospital, or if they're around children that have RSV, they can get it as well, and then they can spread it to others.
Okay, good to know. And honestly, for me as a mom, it's difficult not to be real kissy on my baby, but I'm trying to be more conscious, especially during the season, that I could potentially be carrying some germs that are not healthy for my baby. So even if it's your own child, just be extra safe. Make sure they're washing your hands, making sure you're wiping their hands down, and just all in all, respecting each other's health and taking care of our own at the same time, right?
Yes.
All right, guys. So take care of yourselves out there. Let's stay away from RSV, flu, COVID, all of those nasty things this holiday and winter season. And again, if you find yourself in need of emergency care, please visit our friends at Surepoint ER. Thank you so much, Doctor, for joining us today.
Thank you.